Well, hi, everybody. Thanks for joining me on today's episode of I Don't Care with me, Dr. Kevin Stevenson. I'm sure you'll enjoy today's guest. It's a little bit different than our typical healthcare direct punch, but it is definitely healthcare adjacent and applicable to really any industry. So today's guest is Nicole Riehl. Nicole is the president and CEO of Executives Partnering to Invest in Children, or EPIC. EPIC is a nonprofit founded by business leaders in the Denver area to help employers address workforce challenges through access to high quality, affordable childcare. With experience spanning early childhood education, finance, and nonprofit leadership, Nicole brings a rare ability to connect workforce instability, business performance, and long term economic competitiveness. So, Nicole, welcome to I Don't Care.
Thank you. I appreciate you having me on your show.
Tell my audience a little bit more about Epic and about its inception and about yourself.
Yeah, happy to. So Epic we're a nonprofit organization, as you mentioned. We were founded and created in Colorado by a group of executives and CEOs, some of them being hospital administrators and CEOs of hospitals, in fact, about 17 years ago. And they created Epic because they realized that there was a real economic imperative for them as business leaders to really lean in when it came to childcare solutions, especially as it came to thinking about their workforce needs as business leaders, recruiting and retaining great talent. Of course, thinking about how to support children in their future development and make sure that their future workforce aspirations were being supported. And because we had this future forward group of leaders who really saw the demographic shifts that were coming their way, they knew that this conversation was only going to become more important. So they created Epic as a nonprofit organization to create insights and resources for business leaders when it came to childcare and the implications related to workforce in specific industries. They created us to serve as a subject matter expert and a partner with employers to help them actually implement solutions and, walk that path, if you will, as they seek to address that for their own workforce. And then they created us to also help create innovative public policy solutions and advocate for those on a broader scale as well. So that's really what we focus on. And we're based in Colorado. We work with employers in 8 different states, including Texas, and have had the opportunity to work with many healthcare partners and many CEOs from the healthcare industry around this topic as well. So really excited to dig into this today with you.
Well, that sounds great. So, you've done a remarkable job reframing childcare from being viewed as a family issue to one being seen as an economic infrastructure. So, when you sit down with CEOs for the first time, what's the moment or the data point that suddenly makes them realize, this really is a workforce strategy issue?
Yeah, I mean, absolutely. The cultural context, the affordability context, the family context that we have in our society and in our workforce today has drastically evolved over the past decades. I think every business leader knows that and recognizes it. Knowing exactly what that means in terms of what families are experiencing can feel a little bit challenging sometimes, but I always like to put it into economic terms and into workforce, experience terms. So, the last podcast episode you posted, you mentioned you're a baseball fan. I think you're a sports fan overall, but I know you mentioned you like the Rangers.
Yes, definitely.
And so just to give you an idea, we have been able now through studies to quantify the economic impact of the lack of childcare supply and the lack of childcare affordability for our country and of course states as well. And when you look at the about $15 billion kind of negative drawdown, if you will, economically of having insufficient childcare for our workforce when it comes to what employers are feeling in their bottom lines, it's not a specific expense line item, but it certainly has an impact that would be the equivalent of pulling those major league sports out of the state of Texas, right? It's a huge impact. And so when we think about that, we know it is costing employers money, it's costing families money. When it comes to the family experience, over half of the families in our country cannot find the childcare they need when it comes to actually being able to show up to work. And this is especially true if you have a younger child, say an infant or a toddler. In many cities today and even rural parts of America, you might have 2 licensed childcare spaces for every 10 families who need care. It's a really big issue. And, years ago, people relied on family networks, right? They had the village, so to speak, right? Or you could have a household where one of the adults could stay home with children. That is no longer true for most families in this country, both in terms of having the local village and having the local support system and the affordability piece. And so those things have drastically changed. We now also see that the cost of childcare is higher in almost every state now than the average mortgage payment for families. So it's a really big issue that workers, whether they're, certified nursing assistants or doctors and physicians, et cetera, are really thinking about when it comes to where they choose to work, how they choose to work, and how they support their families.
No, you're so right on that because we've seen such a generational shift in how workers are now looking for a better quality of life. People my age, hey, we kept the notes of the grindstone. We sacrificed family time, whatever. But the younger people really don't want to do that now, and good for them. Number one, but that's really caused a conundrum for so many employers because, back in the day, nobody really thought about providing childcare on campus or providing a childcare benefit or anything like that. So, I'm glad that y'all are taking a look at that. You brought up something else too. And I know, back when our kids were a lot younger, and our friends, you know, we were blessed. My wife could stay home with our children until the youngest turned 8, but many of our friends couldn't. And so I know a lot of them really, put pen to paper and looked at their budgets to see, does it even make sense for one of the spouses not to work because of the cost of childcare? And again, this was 25, 30 years ago.
Yeah, lots of families are now making that choice and making, real decisions around their careers, who they work for, all those pieces because of that financial reality. And we know that there are a lot of people out of the workforce right now who would love to have a career, would love to be in the workforce using those skill sets, right? Using the training that they may have gotten, either through higher education or with an employer and simply just can't right now because they can't either find childcare or they can't afford it. It doesn't make financial sense.
Yeah. So in your work with employers now, do you work with individual employees as far as just what I said, that whole budgeting decision making process?
So, oftentimes, our work is really focused around employers or groups of employers when it comes to thinking about solutions. But oftentimes, that work does include some really intensive survey work and truly understanding the pain points for the workforce and the employers for that matter, right? Where are the employers sitting when it comes to their ability to recruit and retain staffing in their organizations as a whole. For example, sometimes in hospitals too, right? They have highly specialized roles that they have a really hard time filling. Right? It sounds like you have some experience around this. So certainly we want to understand what that looks like. We want to understand what are some of the budgetary pressures on employers around, turnover or inability to recruit, retention. So for example, again, the hospital industry, right? What kind of turnover are you seeing with maybe a single bedside RN, physicians? How many traveling nurses are you carrying on the budget right now? And how might that change if you were to invest in childcare solutions as well? So really understanding what that looks like for the workforce, what the real pain points are. In some markets, you might have a very serious supply issue where you could say, sure, we'll help parents pay for childcare. But the thing is if there is no childcare, it doesn't really help, right? We worked with a ski resort community to develop childcare in their town that benefited both their employees and the town. But when we were talking to their leadership team, we found out there were 76 babies being born in that town every year, and there were 8 licensed spaces for both infants and toddlers. Now you're talking a high cost ski resort town, right? Where people, I mean, everyone's in the workforce up there. They do not have their family nearby. In fact, those 8 licensed spaces for infants and toddlers were actually because a healthcare organization had put on-site childcare in for their staff, but the rest of the town had nothing, right? And so in that case, they had to address supply, right? In other situations, it may be something like the hours of nearby care facilities don't match the 12-hour shifts that nurses and doctors may be working, or you may have an affordability challenge, in which case some sort of stipend could help with that, right? So it can be very nuanced.
So, Nicole, at Epic, you are working directly with employers dealing with absenteeism and retention and return to work challenges. But what are the biggest misconceptions executives still have about the connection between childcare and business performance?
Well, I think oftentimes executives don't know what the real impact is. What we know about workplaces and employers in general is that only about 13% of them actually have any sort of formal feedback mechanism around childcare needs and childcare challenges for their workforce. The rest of the time, they're really relying on things kind of coming up the chain, if you will, which oftentimes we know employees will not disclose to their supervisors for obvious reasons. And so the pain points just really aren't visible. I think the other thing that you mentioned is, oftentimes as a CEO or a hospital administrator, your personal experience may have been much different when it came to childcare, especially if you might be, later in your career and had a much different reality in terms of what that looked like for your family. So there's a little bit of that first step of just really truly understanding and exposing what that might be in your organization. I think the second thing we hear from oftentimes from CEOs or business leaders is they're worried about the cost and the risk. I think risk can be mitigated with making sure that you have a great, partner in whatever kind of services you're offering. And, we help employers do that, all the time and make sure they understand what that looks like. Obviously, the healthcare industry has a lot of inherent risk within it. So I think healthcare organizations tend to be a little bit more comfortable with taking on more risk and really understanding how to hedge and mitigate for that. And then the cost piece, right? It's going to cost money, and it is a cost center. It typically does not make money, right? It's something that employers do invest in year over year, regardless of whatever that benefit is. And the key piece to that is just making sure that we can really reveal what that ROI is going to be for that organization. It's going to show up in different places. It will show up in, faster recruitment into some of those positions we talked about earlier. It's going to show up in better retention, lower turnover, higher engagement, right? Better productivity and fewer call outs. Oftentimes, even employees who don't have young children who may not benefit from childcare benefits also recognize, like, oh, I may not have to pull a double shift as often because my colleagues aren't going to be calling out, or they're going to have backup childcare available, or whatever it is that the solution comes into play that can really help resolve those issues. So, it's really figuring out, like, what is that budget picture? What are those goals? What does a strategy look like for the employer organization? How does childcare fit into that? And, we've done a lot of ROI work with employers, so of other organizations. We have a case study on a resource website that we built out with the US Chamber of Commerce Foundation. And in one of the healthcare organizations that we really worked with on a case study, they have about a 125% ROI coming back to them on backup childcare right now. So they're recovering the cost of that benefit and then some. And, that's not even getting to the brand value that you might receive as a community organization, either in terms of how your potential patients and your employees perceive you, but also the broad community as well.
Yeah, very good. So, my healthcare colleagues listening know what workforce instability looks like every day.
Yeah.
But from your perspective, how much of the staffing crisis across industries is actually tied to childcare access? And are we finally starting to admit that?
Yeah, it's It's a huge part of the story. When we look at that employee survey data, it tells a significant story. We know caregiving requirements in general are being shouldered by about a third of our workforce right now. So this could be caring for young children. This could be having older adults in your life that you're caring for as well. It's a big issue that shows up for people and a huge mental load, right? We talk about, again, I heard you talking about the mental load in one of your previous episodes. When you're in a job that has a mental load like that, and you have these other components of like, oh my gosh, I got to figure out someone to watch my kid tonight because this happened or this happened, right? Or I got to like figure out someone to like go check on my mom or, whatever it might be. We know that employees are carrying a huge mental load there, and it's a significant issue. We did a survey for an airport and, 24/7 operation, right? Where the airplanes need to keep landing and taking off, right? You don't have the luxury of not having staff show up. And, it was about a quarter of their workforce had young children, and 85% of them said that the lack of childcare or lack of childcare affordability had a significant impact on their career choices. And that could have been maybe not taking a promotion. They were also telling us that, they had called out significantly more often because of childcare issues, right? Things like that. So it is a real issue. It is very quantifiable now at this point. And the demographic trends, right? The wave that is coming towards us demographically tells us that this is only going to become a bigger and bigger issue as we have, more people exiting the workforce with this aging workforce population, fewer births, et cetera, right? Paying attention to how you as an employer and as an organization can really open the door and broaden your market to more talent is going to put you into a strategically advantageous position. It's going to put you in a great spot as an employer.
Yeah. I appreciate the fact that you mentioned that caregiving obviously spans, all ages. I had a conversation earlier this week with a fairly early careerist in healthcare who said that he had to take a step back from the workforce because one of his wife's parents had a health issue, and she made significantly more money. So it made sense for him to stay home with her father. And so, well, here's something else, and I know you tend to focus with employers on their childcare needs, but again, I look at it from my own career, and I did say, we were blessed. My wife was able to stay home, but we also faced something in my career. We had moved around a lot early on. Recruiters kept calling. I kept saying yes. We kept doing that. But the toll that took on our kids while they were got to experience a lot of different, geographies and cultures and all that. Yeah, my oldest went to 6 different elementary schools. So I made the decision that wherever we were when she started middle school, that's where we were going to stay until the youngest graduated from high school. Worked out. We were back in the Dallas-Fort Worth area where a lot of family happened to live. But do you ever have those conversations with employers, employees about decisions like that have to be made? Employers, again, back in the day when I was younger, your upward mobility oftentimes was tied to your willingness to move geographically. And so do you have those kind of conversations with employers that say, "Hey, don't necessarily penalize your quality workers for the fact that they don't want to move and uproot their children?"
Right. Yeah, absolutely. I mean, we hear that from employers and employees all the time. And you mentioned the generational shift in the workforce too. I think it's very much the case that several generations ago, you had the attitude and I think the belief that workers needed to adapt their lives to whatever job they had, right, and what their career was. I think the younger generations now coming into the workforce have a little bit of an opposite approach, right? You mentioned the work-life balance desire. I think they very much have much more of an expectation of the employers adapting to their needs and understanding what the reality of their lives look like and thinking about that. And, we worked with a hospital in Colorado on some childcare solutions, including building an on site childcare facility because that's what they really needed to do. And they told us about a couple of their very hard to fill specialized roles that they had traditionally had some challenges filling. So we did some work with this hospital in Colorado where they had some of these, healthcare roles that had been very challenging to fill and had been doing a lot of recruitment to try to get people into these roles. They built on-site childcare on their campus. They started to advertise that and share that as they were doing some recruiting and headhunting and all of these pieces, and they started to get a lot more responses back. B, they would get requests back like, "Hey, I will come to your hospital, but you need to guarantee me a childcare space in your facility for my 2 children." Right? Because that's a problem for me right now. So then it all of a sudden became part of that like bargaining process and actually a contractual requirement in some cases for some of these, physicians or pharmacists or whoever they were to come out to this hospital in a more rural area. But, for them, it was like, okay, the cost of living is lower. I can settle my family here, but I need childcare. So if you can give that to me, I'm here. And they said in some cases that was a game changer for them.
Oh, absolutely. Rural healthcare has enough challenges as it is in recruiting. And so those that are forward thinking enough to think about childcare and other benefits like that certainly do have an advantage.
Well, and I think in this post-pandemic world too, the value proposition of the workplace has shifted fundamentally. We live in this high tech, AI powered world now where, working remotely or having a hybrid option is much more accessible to some parts of the workforce. Certainly not if you need to be bedside and caring for patients. But that value proposition has shifted. And so we also see employers who do have large on site, in person workforce operations thinking about childcare as a way that they can differentiate themselves as employers and say, "Hey, like we've got on-site childcare," right? It creates a different culture and frankly a different like family dynamic on site too for them sometimes, right? Or providing backup care, whatever it is they do, that they see that as a differentiator now too.
So, Nicole, you've got a really unique background spanning finance, nonprofit leadership, and early childhood education. And most people don't typically connect those worlds. So, how did your career path shape the way you approach conversations with business leaders today?
Well, my first really career step over 20 years ago was as an early childhood teacher, teaching in, classrooms and I worked with infants and toddlers and preschoolers, but the difference there is it was actually at an on-site childcare facility for a company in Colorado. And at the time, they were really ahead of their ahead of their peers by doing so and offering that childcare. But I heard from so many parents as a teacher about the impact that had on their careers. They would verbalize for me, like, if I didn't have childcare here, I wouldn't have this job in many cases. And this was over 20 years ago. So today it's even more true now. And so, having that opportunity, of course, to like support the children's development and be in the classroom as a teacher was fantastic. And just to hear the stories from families was great too. Going into the private sector, I kind of saw the flip side of everything from the business perspective of, how do employers and businesses think about the bottom line? How do they think about shareholders and or boards or customers and the community they serve? How do all those pieces fit together as an employer thinks about the next move to make strategically? So, when the job came open at Epic, for me, this was like my 2 favorite things in the world, working with business leaders and early childhood and thinking about childcare and early education as critical to that workforce, component and the economic and the strategic needs that business leaders have, and I kinda joke with people, I'm like, "Give me any topic and I'll tell you how childcare connects to it." or
Yes,
early education,
yeah, I can already
right?
tell that.
Yeah, so it's been a really fun. I think everyone has these like interesting zigzagged career paths, right? No one's career is linear. And I always, when I mentor people, I always tell them that, I'm like, you don't have to have it figured out. And chances are what you think you're going to be doing 20 years from now is probably not even close to what you're actually going to be doing. So just enjoy the ride, follow what you love, invest in yourself, learn, be curious, all those things.
Boy, you've taken a page out of my playbook with that statement. So we hear a lot about the future of work, but not nearly enough about the future workforce itself. So what really worries you most if businesses and policymakers fail to address affordable, high quality healthcare or childcare over the next decade?
Well, I think we really do have this seismic shift happening with our workforce demographics right now. Taking into account, like, yes, will AI change some jobs? Yes. Like, will automation change some jobs? Yes. But when we look at the numbers, we still know that we do not have enough people in the workforce in the future to really fit the needs that we know our economy and our industries have as a whole. So we really do have to think very creatively about how do we capture, as much opportunity as possible as business leaders and employers and think about that workforce recruitment and retention piece. It will be a part of how people are thinking about their career paths, how they're planning their families, how they are deciding to move for a job or not deciding to move for a job. And, the really, I think, forward-thinking business leaders who are thinking, 5, 10 years down the road, childcare is table stakes for them now. It's not like a nice to have, we'll add it if we can. Childcare is, we gotta do this now, and we need to figure out, like, what we're doing now so that 5, 10 years from now, when everyone's feeling the pain, we're way ahead of the group, and we know exactly what we're doing.
In our last few minutes, you spend a lot of time with senior executives and boards, and if you had 5 uninterrupted minutes with every CEO in America, what would you want them to understand about childcare and their competitiveness in their industries and leadership that they probably aren't hearing from their own HR departments?
Yeah. Well, I think implementation is different from return on investment. Implementation can be done well. And I think that's the beauty of why business leaders created my organization 17 years ago. They knew that implementation was challenging. And they were like, we got to create an easy button for this for business leaders. And that's what they did with creating Epic. But I think aside from that, it's important for business leaders to know that in every case of ROI we look at here, business leaders and employers recover their investment and then some. We see anywhere from 100% to 400% ROI on these childcare investments from a bottom line and a workforce perspective. And those numbers will only go up over time as our workforce dynamics continue to change and it becomes a much more competitive situation. So I think it's easier. It can be easier than you think it is. The cost can be recovered and will be recovered in those investments if done properly. And I think the last thing is just to really take the first steps to understand what that might look like. We developed a free tool with the US Chamber of Commerce Foundation because we heard from business leaders, this is complicated. This is hard. We don't know what to do. We don't know what the first steps might be. And so we built a website. It's the employerchildcarenavigator.org. So a free website, no cost to employers. They can take an easy 2-minute assessment about their workforce. It'll give them some kind of first ideas of what might address their childcare needs as an employer. And we look at all sorts of things like, do you have in-person workforce, hybrid hours, multiple locations, right? All those kinds of things to really understand what might work. There's so many case studies on that website. So if employers really want to understand what that looked like for other employers, they can read about those solutions and some of their lessons learned and what their advice would be. We have a vendor directory. We've got lots of other tools and resources like free survey templates, et cetera. As I mentioned, only 13% of employers are actually asking about this. And I think sometimes they're afraid to ask. They don't want to set expectations, right? But just communicate to your team that you really want to understand what their pain points are, and you don't have to set any expectations that you're going to implement anything particular. But, I always say start with little wins if you can. Culture changes, right? Normalize, don't apologize. This is a motto I like to use. Normalize the fact that people have caregiving responsibilities. They have families, life happens. Whether it's, an older adult in your life falls down and you need to make sure they get the proper health care, or your child is sick and, you don't have childcare that day. So, those are all facts of life now, and they are impacting your bottom line. They are impacting your workforce and your culture and all those other pieces. So, I think the first step is just to really be open to understanding what that looks like.
Well, very good. Nicole, I've really enjoyed this today. It's not a topic that I had to think a lot about personally, professionally, yeah. But unfortunately, I oftentimes turf that to my HR department. So
Well, it takes executive leadership and sponsorship for this kind of thing, I think, the path of least resistance is obviously the path that people will often sometimes wanna take, and childcare can feel hard to tackle at first, so having the C-suite behind that to say, "This is something we need to look at, this is something we need to do for the future," is really important.
thanks, Nicole, for joining me on today's episode of I Don't Care. I think we've all really learned a lot about how childcare can really positively impact a workplace. And whenever that business really takes hold of and understands the needs of their employees in and around childcare, I think it's beneficial to all. So, again, thank you so much for joining me.
Thank you, I appreciate it.
And folks, thank you for joining me on today's episode of I Don't Care with me, Dr. Kevin Stevenson. It's been a real pleasure, and I look forward to seeing you again next week. Take care.